normal digestion, ultimately, titingnan natin yung kung gaano kadalas tayo nagkaka-bowel movement. So, regular is, 1 to 3 times a day. Tapos, kailangan dapat i-normalize na wala tayo dapat nararamdamang nausea, wala dapat na pagsusuka, wala dapat kabag, walang, abdominal pain or yung pananakit sa tiyan, right? So, dapat wala yung mga experience na ganun. So, kung may mga elemento ng mga nabanggit ko na medyo, off sa inyo, then saka dapat magkonsulta sa healthcare practitioner niyo, right? So, yung healing the gut essentially is understanding kung ano nga ba yung particular na issue ng nung taong nasa harap mo, right? So then saka tayo magkakaroon ng proper na investigation, right? So ideally meron kang kausap na doktor na nagtatanong sa iyo kung ano nga ba yung nararamdaman mo, paano ba nagsimula, ano pang mga sintomas ang bumubunga mula sa sa history ng issue ninyo, right? So dapat alam natin kung ano ba talaga yung issue at hand. May dalawang type po na ng IBS. So may constipation type, may diarrhea type. So kung may tendency yung tao na siguro parati siyang, nahihirapang magdumumi, or on the other hand, siguro parati siyang nasa banyo, right? So yun yung isang criteria. Tapos yung pangalawang criteria po nun is kung after nung pagdumi ng person na yun, may relief, right? So, kapag significant na mas bumuti yung pakiramdam nila after nilang dumumi, then yun yung parang isang confirmatory evidence na, okay, siguro IBS ito. Tapos yung isang criteria, obviously dapat hindi lang siya one out of, one instance, right? Kailangan chronic, may chronicity po tayong hinahanap, right? So kung siguro more than 2 to 3 months, parating ganito yung experience nila, then saka natin siguro ma-assume na posibleng ito yung diagnosis nila. I think na-underestimate po natin yung value ng pag-monitor ng sintomas kasi minsan saka lang natin ino-note kapag ayun nga, nagka-diarrhea one day tapos ang automatic na assumption is kung ano yung kinain mo one day before, right? So, ang parati kong advice is siguro give it some time, mga siguro 1 month at least, para at least meron tayong steady na pag-monitor ng mga patterns na siguro na luluwas sa pag-note-taking ninyo. Kasi, ang science po behind that is that minsan it takes a while for food to fully come out, right? So I mean that's not really the most accurate way to describe it, pero hindi dapat basta-basta na okay within the 2 to 3 day time frame lang yung basehan ng pag-monitor. Dapat merong vigilance to some degree para at least nakikita nyo kung meron nga bang specific food triggers na magkakos ng onset ng digestive issues ninyo. Bukod po sa food journaling, I think mahalaga rin po nating ma-monitor yung pagkakaiba sa routine, right? So, kung may pagbabago ba sa ilang oras ng tulog ang nakamit ng tao, right? Or kung gaano ka-stress ba sila nung isang araw. Kasi malaking proponent po ng IBS ang stress, ang depression, anxiety din, right? So anyway, very interesting relationships to explore. So, yun, mahalaga po yung stress levels, yung mood, yung siguro even exposure sa routine. So kung halimbawa, nagta-travel kayo at that time, right? So very normal, very expected na sa ibang tao, pagka may onting travel, syempre madi-disrupt din yung digestion nila. In my practice, hindi naman kailangan na super restricted nung dietary changes ninyo. Depende rin naman po kung gaano ka-complex nung issue. So sometimes it may help some people to, maybe for a good week or two, mag-eliminate ng panandalian ng mga alam nating trigger nung symptoms. So, at least mabigyan ng oras ng katawan na makapag-recover, right? So, literally letting the gut heal at that time. And then, in some cases, it's, siguro ma-incorporate natin kung ano yung nalaman natin mula sa food journaling or, routine journaling, right? So, then, pwede nating i-apply na, sige, tingnan natin kung pwede nating, i-minimize yung burden ng sintomas by supplements, acupuncture, or whatever may be relevant to the case. Tapos, saka natin, pwede nating bigyan pa ng specific timeline kung, kailangan ba natin talaga mag-restricted eating, right? So, for the most part, hindi naman kailangan, right? Again, depending on the case. And syempre, todo suporta. Working with someone like me, hindi naman po ibig sabihin na kailangan mong maging off ng medications. Ultimately, kailangan maraming instances na life-saving itong mga medications na to, right? So, I think where we come in is more, yung kadalasan na naririnig ko sa practice ko is minsan nakakalimutan nung pasyente kung ano nga ba yung reason kung bakit natin tinitake ito, or siguro may conversations na many years na nandito pa rin yung medications, pero yun pala dapat matagal lang nag-stop, right? So at least may opportunities na ma-refresh yung goals, kung ano ba yung plano nila with respect to their health, kung mas satisfied po ba sila sa at least pag-manage nung specific issues with medication. So at least sa parte ko naman po, mako-consider ko siya. At hindi naman po ako basta-basta mag-recommend ng mga supplements or dietary regimens na magka-counteract sa medications. Kailangan kasi dapat mag-work together yung mga aspeto ng kanilang kalusugan nito, right? For people like myself who work with drug-herb interactions, that's something that we are always mindful about naman. Tapos, syempre, again, reassessment lang kung ano ba yung goals ng pasyente. Kasi ultimately, sila naman yung magdidikta kung anong gusto nila mangyari, right? So, and then, syempre, yung what I mentioned, assistance din para, mas self-sustaining sila with respect to, food choices, yung stress management nila, lifestyle, and all those things. So many possibilities naman po. Hindi naman po necessarily na because you're seeing your medical doctor, your specialist, and you're on specific medications na automatic na you have to come off of that. In reality, it's the opposite of that naman po.